In today's episode of the Exam Room podcast, we conclude our conversation with Dr. Mary O'Connor as we explore what it will take to truly transform healthcare delivery in the United States. Dr. O'Connor and Dr. Rhiannon Windsor discuss the importance of understanding patients through a holistic lens and how community-based care models, like those found in federally qualified health centers, are already helping move healthcare in a more patient-centered direction. They also tackle one of the biggest challenges facing healthcare today, the financial structures that often prioritize volume over value. From surgical incentives to fee-for-service pressures, this episode takes an honest look at how current payment models influence care decisions and why innovative, value-based approaches may hold the key to improving outcomes while lowering costs. Join us as we close out this powerful series by examining how healthcare organizations, employers, and communities can work together to build a more sustainable and patient-focused future.
What are some things that you think they can do to influence behavior change?
So, from my past experience with FQHCs and what I know about them, I would say in general, they understand the patient from a holistic perspective more so than in the traditional setting.
Yeah.
So right there, kudos, okay? Because they've already kind of acknowledged or anchored to, we actually need to understand this patient as a whole person and some of the factors that are influencing their ability to take their medication or get to their medical visits, right? They're already ahead of the curve on that. I think that FQHCs providing those kinds of small support groups for patients, I believe that some of them do. I don't know how many of them do, but I think that's a big opportunity.
When you think about the future, what gives you hope about our ability to influence health by investing in community and community support?
I think that there's much better awareness, not as much as we need, but an improved awareness of the influence of social determinants of health on individuals, families, and communities. And that's an awareness that even if you go back 10 or 15 years, I don't think that we had this much awareness. So that's good, because we can't make change until people start to understand the need for change. I'm hopeful that FQHCs can continue to be supported or expand, and that overall other healthcare systems will start to look towards a more holistic model. The challenge, one of the huge challenges, is that the current healthcare systems don't do that now, can't do that now because of the way the payment model is for traditional systems in this country. So,
Yes.
In brief, right, all healthcare systems in the United States generate their financial margin on elective surgeries, advanced imaging, and procedures. That's how everyone makes their money. Now, they have to make profit in orthopedics, in spine, for example, generally big profitable service lines for a healthcare system, because they always lose money on service lines like pediatrics, like infectious diseases, like endocrinology, right? And
Yeah.
you have to have these other services if you're going to take care of a population. If you're going to take care of your community, you have to have all these services. But the way that the payment model is structured, they lose money. So they have to make money on the profitable service lines to offset the losses on the ones that aren't profitable. And what does that do? That incentivizes systems to promote the activities that generate the financial margin. So if you go to any healthcare system and you looked at the administrator in charge of a surgical department or a surgical service, I would bet dollars to donuts that one of their key performance metrics, that it's surgical volume. So how well that administrator does their job is linked to how many surgeries are done that year.
Mm-hmm.
Okay. It's not where the right surgery is done. It's not where patients properly selected. It's volume, because volume is what drives their financial margin. Now, these are not evil people. I have to say that these aren't people that are saying, oh, we should do inappropriate surgeries. Okay. But the system inherently promotes surgical volume, procedures, and advanced imaging, because that's where the margin, that's where the profit is. And they need to make that profit to pay for all the things that will lose money. So the whole system is so badly messed up.
It really is. It reminds me of a conversation I was having with someone from one of our FQHCs that said, well, we've been focusing so much on quality that we're not really bringing in any profits, and we're suffering. So now we have to think more about quantity, and that fee for services, what's putting money in the bank, not the focus on the value-based care portion, especially since health centers aren't going to see any of their shared savings for almost a year after they make it. So what do they have to do now to support their operations and sustain themselves? Has to be that fee for service model until we can figure out how to change that, because the shared savings, because they're part of our ACO, isn't going to come for months and months and months later.
Correct. And so that's why at Vori Health, we're focused on, transforming the delivery of musculoskeletal care, because we think that our model is better for patients and it lowers healthcare costs. And we need to do both of those things. Like, we can't be naive and think that just spending more is the solution.
Yeah.
Employers cannot afford to be spending more on health insurance for their employees. And we have contracts with a lot of self-insured employers. And you know what? They actually want to really provide good care to their people. Their ability to be successful as a business depends on the health of their workforce.
Absolutely.
They're not trying to, they actually want their people to be healthy and be able to be productive at work. But they also cannot absorb, huge increases in healthcare premiums year after year after year.
Yeah.
So we simply have to keep working on models of care that recognize that we need to take great care of patients. We want to take great care of patients that do it in a more cost-effective way. So
absolutely.
That's
Thank
the
you so
challenge.
much. Yes,
And
it is. And we really hope that this podcast helps to raise awareness of these things, because we really care about patients too. It's always like that same old story I've said before, every 3 or 4 months, whether my car needs it or not, I take it and get it maintenance and I get the oil changed, and I think a lot of people do that, but do they get their body maintenance, their preventive care? No, not typically. We just wait till something's not feeling good, and and then we go in. And so the more that we can raise awareness on both sides, the better off we're all going to be.
I know. It's the challenge, but it's also, it's also meaningful. It's personally very meaningful to me that I'm doing this work and my team is doing this work. We need to be unafraid to challenge the status quo and find better ways of taking care of people.
Thank you for joining us for this 3-part series with Dr. Mary O'Connor. Throughout this conversation, we've explored how value-based care, holistic patient support, and innovative delivery models are shaping the future of healthcare. If you found this series helpful, be sure to subscribe, share this episode with colleagues, and continue the conversation about how we can work together to improve care for our communities. Until next time, this is the Exam Room Podcast, where we bring healthcare insights into focus.